Hi there, my name is Vicky Davis. I'm a family nurse practitioner and I work in women's health. And I'm here today to talk to you about women's reproductive health. And one of the most important aspects of that is going in for your annual Well Woman exam. And that includes a good physical exam from head to toe that includes breast as well as pelvic, and also issues as far as what's going on with your reproductive health. We recommend that women do this once a year, and you can start that at any age between 18 and 21 or within the first year of becoming sexually active. And the reason that we suggest that is because once you do become sexually active, you could be at risk for certain infections or other problems. And also, too, you can go sooner if you were actually having problems with your menstrual cycle or other, family or medical concerns. As part of that annual exam, the most important part is the Pap testing. And talking about the human papillomavirus, we found that it's responsible for cervical cancers. And then we also found that it can be preventable. And the way it can be prevented is by routine screening, and that's going in for the annual Pap test, as well as a new product out called Gardasil. That's a vaccine that's going to cover 4 different types of the virus that can actually cause cervical cancer as well as genital warts that a lot of people suffer from. At this present time, we recommend that women between the ages of 9 and 26 get this vaccine. But Merck, the company that makes the vaccine, are also doing research studies on vaccinating women that are outside of that age group, because HPV can affect any woman at any age. But generally, younger women are at greater risk because they have a more immature cervix, which can make them more predestined to pick up this virus and not be able to clear it from their system. But older women can also have it. The other things that we can do with the Pap testing is also screening for infections. And many women suffer from common things like yeast and bacterial vaginosis. So the test is very beneficial for covering that as well. And also during your Well Woman exam, you also can cover certain things that are good parts of your health as well, because many women don't go to any other providers, so this is a good access to health care. During this time, we can talk to you about your general overall health and certain risk factors that you may have for either different types of cancer or heart disease. So at this time, your provider can cover different topics, your reproductive health, your overall health, and any concerns you may have about your menstrual cycles. So it's important that when you go to your exams that you talk to your provider in an open fashion and don't keep anything from them. They've heard most everything, so they're not embarrassed by anything you may ask. So use this time wisely to discuss different topics that may be bothering you. And some of the topics that can bother a woman are what their menstrual cycles are like. They can have heavy bleeding, painful periods, or pain with intercourse. So talk this over with your provider about what you could be having. And there are many options to take care of these issues. For example, if a person's having heavy periods every month with a lot of cramping, there are ways to manage this. And some of the more common things are actually birth control pills, because they help to stop ovulation, and they also help to thin out the lining of the uterus so that your periods are lighter and very predictable. And then for those women that are having bleeding that is not controlled by this, other things can be done to determine what's going on. We often do blood tests to determine if you have an irregularity in hormones, which can include thyroid as well as ovarian function. And let's say that we find out you have an abnormal thyroid, we can start you on medication to get things under control. But for those women that still have the heavy bleeding, there are some newer procedures out there that can help, especially if you have just an abnormal thickness of the lining. And you may have heard it on TV. It's called NovaSure, and that's pretty much one brand name for a thing called endometrial ablation. With that, you can have the lining of the uterus basically burned, and it basically stops your periods, or in some women can still have a normal period, but much lighter and much less painful, because lighter periods lead to less anemia and problems with how you feel. Then there are women who often suffer pain with their periods and sometimes during intercourse. And especially in women between the ages of 20 and 30, endometriosis can be a large problem that can cause that. And endometriosis is where parts of the lining of the uterus have implanted itself on different parts of the body. It can occur on the outside of the uterus, the ovaries, and the fallopian tubes, and sometimes even within the pelvic cavity, attaching itself to the bladder or the bowel. And this is usually diagnosed through doing a procedure called a laparoscopy. This allows the provider to look inside and see what's going on. If there is areas of endometriosis, then they can actually do an ablation or removal of these areas. And then very often they may put a woman on medications to help control this, which can include birth control pills or a medication called Lupron. And Lupron is given over 6 months. It's a monthly injection to help shrink up these areas. And eventually, for those women who can't get that under control, they can eventually end up with a hysterectomy, which is the final solution. But we generally reserve that for women who are past childbearing age. And then other problems that can occur is also women who actually don't have regular periods and are possibly trying to conceive. And this is women that we can help counsel and figure out why they're not getting pregnant. So it's important that when you do come to your exam every year, that you do keep a detailed record of what your menstrual cycle's like, so that we know when it starts, when you think you ovulate, and what kind of problems you may be having with your menstrual cycle. Your annual Well Woman exam is a very important part of your reproductive health. It's important as a patient that you maximize this time with your provider. When you do come to these exams, you want to come prepared. You want to bring a record of what your medical problems have been, any medical changes that may have occurred in the past year since a person has seen you. You want to bring a record of your menstrual cycle, what it's been like and when the last period was, and you want to bring up any concerns you may have. And those concerns may be wanting to cover birth control or breast health, or just almost any question that you want to ask your provider. They are very open to questions, and they like questions because they don't want you to leave the office feeling like you've missed out on something, and never be embarrassed, because they never are. They hear many questions and they want to answer them truthfully for you. And when you do come to your exams, it's important that when you get your Pap testing done, if it is scheduled, is to come pretty much mid-cycle so that you're not on your period when you actually come in for the exam. The other important aspects are not douching within several days or having intercourse before you come in for the exam. And on the point of douching, it's usually best to just avoid that altogether. It can actually be harmful to the vagina and cause more infections. So whenever you do plan your exam, think of those things before you actually schedule the appointment, and bring a list with you. If you're very nervous when you come, you can certainly bring a support person with you. That can be your mom, it can be your best friend, and they can also be your second set of ears, so that if you miss something, they can repeat it for you. And also, when you leave your visit, you can always be assured that you can call back if you had any other questions that you want to concern. So hopefully today I've answered a few questions or covered a few topics about your reproductive health.